Hello, everybody, and welcome back to another episode of Getting to Know You. You all know me, your host, Jen Dawson, Pedra's Associate Director of Educational Programs, but today I'm delighted to be joined by Dr. Bella Plumptre. She is in her final year of residency at the University of Massachusetts, and she has been participating in Pedra's birthmarks and genetics focused study groups. And my hat is off to her because she graciously took on mentoring a group of medical students for us on this last mentorship cycle. So welcome, Dr. Plumptre. I'm so happy to be talking to you today.
Thanks, Jen. I'm excited to be here.
So let's get started with the same question I ask everybody. How did you come to pediatric dermatology?
Yeah, great question. I think I have a similar path to lots of people in that I knew I really liked pediatrics. And that was always something that I was thinking of pursuing long term. I did a derm rotation when I was in medical school sometime in the middle and really liked that. And then I found out that peds derm was a specialty that existed, which I had no idea about up till then. I did a rotation in London at a pediatric dermatology tertiary center and just absolutely loved it. I was blown away by the kind of patients that they saw, the ways that they were thinking about the patients in the long-term integrating research, and just really found my people. So I really came at it from a pediatrics angle more than anything.
So let's talk about your research interests. We were talking before we officially began and said that you've joined some of the birthmarks calls and had some interest in some projects that are going on there. So tell me more about your research interests.
Sure. So within PSDEM, I think there are so many different areas that are super interesting to me. And it really spans the whole way. I really like vascular and pigmentary disorders in particular, but even from the genetic standpoint of genotype phenotype correlations and matching out how we could maybe borrow drugs that already exist from other specialties to treat patients in a targeted way, all the way to how it means to be in the clinic and have a new diagnosis or something complicated that you need to go through in a short amount of time with a patient and their family, and how best to communicate that and how to make decisions together. So I really like every portion of that, from figuring out things that are new and figuring out different ways that we can approach problems to thinking about how best to communicate with people.
I love that. I love this idea of repurposing drugs from other areas. There's so much room for innovation there. It must make it really exciting as a researcher and as a clinician.
Yeah, absolutely. I mean, that's certainly not something that I can take credit for at all, but it's something that I think is
Right.
exciting about for the future.
Yeah, very exciting. What are some of the challenges you have had to face in your training so far?
Um, that is a very good question. I think with dermatology, there's a lot to learn, and that's something that as a student you don't really get exposed to that much, right? You might do a few derm clinics at some point during medical school, but dermatology as a whole, there might be only a handful of lectures across your whole preclinical time. So that is certainly one of the biggest challenges of being in a residency training program, is physically getting to grips with all this new material and being able to apply that in clinic, and being able to think through how best to use it to help people. Sometimes people have asked me, like, how should I prepare when I'm a student? Like, how should I think about it from a dermatology
Right.
perspective? I think it's I think it's a problem for another day, and that it's great. Anything along the way is fantastic, but the training really makes you think about it in a different aspect that I didn't really appreciate before, like how much things, when you look under the microscope, how that feeds into how you build a differential diagnosis and think about different options that could be on the table for what is causing problems for people, and then using that to decide how best to do other tests and treat them. So there's a lot of material to learn, but it comes just with time. Like now, being at the end of my residency, that's why it takes 3 years of residency in dermatology to learn it.
You said yes when I asked you to mentor a group of students. So when you're looking at mentorship, both having been a mentee and now as a mentor to students, like what's kind of your approach? What are you thinking about as you're working on those relationships?
I think that the main thing is I was helped by so many people along the way when I was figuring out what I wanted to do, and still work in progress. I'm figuring things out every day, but I really benefited so much from so many people helping me think through that and build on skills and thinking about what my career might look like. Especially coming from abroad. So I trained in the UK. I went to medical school in London. My husband's from Massachusetts. So long story short, that's why we ended up here. So I came from a completely different system. I didn't know anything about how US medical school really worked, or dermatology or residency applications or anything. And I did some away rotations and was really, really helped by a number of people who were residents and attendings. So I think I have a lot to pay forward in that respect to other people who are in those early stages too. And really, people help me so much by thinking not only what I might be interested in, but helping me to explore it in tangible different ways. And whether that's just through talking through their experiences, or whether it's through setting up with projects like quality improvement or smaller research projects. Mm-hmm. And some of those really help me to kind of have something that you can put your teeth into and dig a little deeper in the literature and figure things out from the ground up. Really helped me to think about the kinds of things that I was really interested in. So sometimes when I approach mentorship with people, it's exploring what kinds of things they might be interested in to start with, or even they might not even know. They might just know that they are interested in dermatology and that they know that they like kids or that they like adults or anything. And so sometimes it's just as simple as helping them think through what might be ways for them to explore how what ways they might be able to explore what interests them, and help them figure out if this is something that they'd like to do in the long term. And if it's not, then that's totally fine too. Just, it's sometimes helpful to help people be guided down one path or another.
What would you say so far has been the best piece of advice you've received from mentors thus far in your training?
That's a really good question. From mentors in my training, one quote I really like is, will it matter, or what would you choose if you're 90? Like, what would you look back on and think, I'm glad I did that, or I wish I did that differently. Sometimes that has helped me think through different decision points. Not always career focused, sometimes life focused too. Or another one that someone in my program has told us is, when things aren't going well, take notes and then think about what you could do differently another time.
Both of those sort of in the spirit of reflection and, setting yourself up for being proactive rather than reactive, it sounds like. So we touched on this a little bit when we talked about your research interests, but 10 years from now, your career is established. What do you hope to be working on, or maybe having had accomplished?
So I think I would like to be working in an academic center as a pediatric dermatologist. That's certainly what I'm aiming to do going into my fellowship. I think that there are so many different hats that you can wear as part of a career. Some people focus on teaching, some on quality improvement, some on research. I like a lot of hats. I don't know which ones I'm going to wear, but I think that I will do some kind of research in some way, and I would love to be involved with teaching, at a medical school and helping people think through what different ways that they might want to pursue a career within pediatrics or dermatology. But I don't know exactly what my career is going to look like at this stage. I definitely like vascular anomalies too, and that's something that I'm pursuing more in my fellowship to think through how that might be incorporated. But the rest is to be seen.
It's so hard to think that far in the future. I'm just trying to figure out what I'm going to make for dinner tonight. And that's as far in the future as I can get,
Exactly. Yeah. I think there's a lot to be said for that. I just had a baby this year, so we're taking each day as it comes and figuring things out step by step.
Congratulations. How old is baby?
She's 5 months. So yeah.
Oh, so you're just really in that day by day world.
Yeah, I'm out of the phase where you put diapers in the fridge,
yes,
because you know what your name is. But now that I'm back at work and everything, we're taking things day by day.
Yeah, for sure. Oh, I remember that time. Well, before I let you go, is there anything about yourself personally that you would like to share? Either a hobby that you have, a hidden talent, a funny story?
Let me think. Hidden talents are tough. I feel like so many people just pull out the bag, that they've been a world leader in some respect or in a national orchestra or something like that. Anything as glamorous as that. But I am not someone who's very sporty, but have got more into that with time. So my husband and I have a tandem bike, and we've done a lot of adventures around the world on that. So we've done trips in Australia and South Korea and Japan, and we did a big trip across the UK before we moved over here a few years ago, from the tip of England to the northern tip of Scotland. So
oh my gosh. That would be such a great way to see the world.
It's a really fun way to see places because it takes you to places where you wouldn't get a train there, or you wouldn't drive there and stop.
Right.
But you just really go through all these smaller towns and villages and have to figure out how to order food in different languages and figure out where you're staying. So I think you see a very different flavor of a place. And it means that just the whole journey is the fun of the trip rather than trying to get to the next place.
Yes, I agree completely. That is so cool. What a great tidbit to share. Thank you so much for joining me today, Dr. Plumptre. It has been really lovely getting to know you. And thank you for joining Pedra and being a part of our network and working within our mentorship program. I am so grateful for the time you give us. Thank you so much.
No, thank you, Jen. This is great.
Thanks so much for tuning in to another episode of Getting to Know You. And a special thanks to Dr. Bella Plumptre for joining me today. It was lovely getting to know her and learning about her work. If you would like to be a part of Getting to Know You, send me an email at info@pedraresearch.org. Make sure you like and subscribe to the Pedra Pearls podcast channel in iTunes, Google, and Spotify. And be sure you're following us on social media. We're on Twitter, Instagram, and Facebook at Pedra Research. We'll see you next time.